If one eye is completely destroyed by the arthritis and there's no vision, no chance of improvement, sometimes they have to remove the eye?
That's a very rare circumstance. An enucleation is probably the last thing any doctor would do. If the child has painful loss of vision and complete blindness, yes, certainly at that time you can think of an enucleation, but it's very rare that children who had juvenile rheumatoid arthritis get to the stage where they need anything close to an enucleation. Most of the time, the child could have the iritis, which is bad, secondary glaucoma, cataracts. Usually surgery will take care of those problems or medications, but in the very, very severe cases, it's unlikely, but it could potentially happen. I just haven't seen one yet.
If one eye is doing well and one eye is not doing well, can that bad eye indirectly affect the good eye?
Well, that's unlikely. Usually, if I've had very, very asymmetrical cases of uveitis where one eye is always the bad one and one eye is it's not affected quite as much as the other eye. So it usually doesn't have one affecting the other. There's an actual syndrome called sympathetic ophthalmia, which I think a lot of people confuse it, and that's only if the patient has a penetrating injury. Usually it doesn't happen where the child's immune system recognizes the other eye unless there's been some type of penetrating injury. So usually the eyes work separately, although you'll see a lot of bilateral cases.
So this is a sort of a partnership between the eye doctor and a rheumatologist, the best possible results of care, is that correct?
Absolutely. The pediatrician is the first one to basically suspect the problem. He'll then send it to the pediatric ophthalmologist or general ophthalmologist, whoever he's using at the time. The ophthalmologist will make the diagnosis of anterior uveitis. He will then make sure that all of the proper tests are ordered. At that point in time, he'll probably send the patient or advise the pediatrician to send the patient to a rheumatologist.